problem would have found us in the middle of the ocean.
So anaesthesia is a branch of medicine that is very critical because many people know when you are going to theater, they only know and think about the surgeon. But the fact is, the surgeon cannot operate you if the anesthetist is not available to give you drugs that will make you, number one, not feel pain, but equally important to make sure that you are very safe, because one, the drugs we use are very, very strong. So we have got to make sure that we give you the right kinds of drugs and dose so that you don't get complications.
We want this very, very big aircraft. I know it was Emirates or something.
Today we are hosting a second World Day of Regional Anesthesia, which is being celebrated across the world to commemorate the start of Regional Anesthesia, which the first celebration was last year, and today we have joined more than 200 cities across the world, working towards a pain-free future for all worldwide. We've had several steps in improving regional anesthesia in our country, in Africa, and in the world. We find less complications compared to general anesthesia. Patients also have a longer pain-free period. Technique really needs to be well taught. People need to be sure of the practice before they actually start this procedure on a patient. Patients need to have the information so they can choose rightfully between having a general anesthetic or a regional anesthesia. But overall, there are more benefits for having a regional anesthesia, including a reduced length of stay in the hospital, drugs that are needed, having the actual needles, having certain other things like nerve stimulators, regular availability of these usable products. When they run out, then it's difficult for us here in the rural setting to be able to perform these blocks as much as we would have wanted to for the patients. And then in the absence of the right equipment, of the right needles, of the right drugs, you end up having a patient who would have benefited from a regional anesthesia eventually ending up having a general anesthesia. And yet, if these products were available as required, as per the volume of surgery, you would find that patients would be worked on, would have a more pain-free postoperative period, and would even probably have a reduced length of stay in the hospital. So we continue to call out to government. We are grateful for the support this far to the university. We appreciate that we have come this far, but we know that there are still many steps that we can take to get much better, to join the rest of the world, to continue implementing this regional anesthesia more efficiently.
Kushemeza omuntu bamuterage nanke kikatu akakaba wena kagumayo bakamanza bategereza akamaro y'ubwire burengo nangwa bumwe kikatinisa na bamwe abamubweza konka barete system yo kugira ngo bakabese ahantu bo bari cooperating abo bari koraho konka umuntu agumahurire bumwe abari no kuganira nabo n'ikirungi kandi kirahesa nawe nankeji nabaraba bamugweze kibahesa mani
tunoga byinshi ngende yakiyamba akatukera ho buryo mane ke turanguzirwa n'abagwari saranguzi abwo kwa yondi zikakareho umuntu bazaga kumushemeza babanza bamwita wena rero kandi kuzakurwa no bamuhire musiyete.
But if they hadn't checked, we would